my comment here is that had we been notified, it would have at least allowed us to look before we had the 10 weeks that we had to start working.
I want to make sure that I hear your voice. I want to make sure that I hear alternative options. I want to make sure that we're trying to figure this out together.
I think that brainstorming brings people together with a lot of ideas that sometimes are out of the box and creative, and having a room full of people here is probably getting a lot of those creative juices flowing. But one of the things that I was thinking about was years ago, and I don't know if it still exists or not, but years ago Woodrow Wilson School had a clinic in the school. They actually were set up with their own health clinic. They had nurses, they had patient rooms, they had everything. I understand the shortage, but I also understand that, you know, this facility and its purpose, we fought long and hard for this. I do remember the vote at town meeting. I do remember the generous gift from the Blazes. We're in the room named after them today. And I do think that with our growing population, it would really help if we could expedite the process, but definitely look at some other options, maybe bringing some other potential partners to the table.
You're going to have to put money into renovating space here, and then put money into renovating a permanent location down the road. Isn't that spending money that we shouldn't? I mean, wouldn't you be better off identifying a permanent space, even if you have to pay rent at it, and then put the money in for renovations?
That includes the corridor, that includes the storage room. There's obviously the Heritage Gallery, and that's the multi-purpose room. So we are going to rotate the parking with the staff of the health department, not the park here. It's going to be off-site. They're going to park either at the cottage, or there's other avenues that we normally do at the Memorial. We have 44 spaces.
People, please move over to the podium if you're going to ask questions, please.
Due diligence, and I looked at several buildings in terms of because of the promise.
Why can't we talk with Smart and see if they don't have some kind of facility, some space that we can use instead of taking our senior citizens?
What Mr. Keyser says about the process, if we were paying for space, is correct. If someone were to donate space for us, none of that comes into play. There is no RFP. If we wanted to use modular trailers like we used down at DPW and had somebody willing to donate a parking lot, and that could be done with a donation and not have to follow the other processes.